Good morning, sir and my friend. I'm Jeting. Today, me and my partner, Siqing, will present a topic about robotic exoskeleton. World Health Organization (WHO) point out that every year around the world, between 25,000 and 50,000 people suffer a spinal cord injury. The majority of spinal cord injury are due to some causes such as road traffic crash, fall, violence, and work or sport-related injury. Spinal cord injury make a person face obstacles in daily life, such as experience in pain, difficult in breathing and holding, increase the risk of urinary tract infection, and also cause depression. Therefore, robotic exoskeleton, which is one of the rehabilitation service, should be provided to people that suffer in spinal cord injury to overcome the obstacle. Robotic exoskeleton are wearable electromechanical devices that have been developed as augmentative device to enhance the physical performance of the wearer or as orthotic device for guide rehabilitation or locomotion assistance. This enables people who suffer in spinal cord injury with appropriate physical ability to stand, walk, or climb stairs. The potential benefits of robotic exoskeleton are endless. Let me introduce myself first. I am a first year biomedical student and I am doing a lot of research in this field. Currently, I have learned the most efficient way to recover a person who suffers from spinal cord injury through the endocrine and nervous system cause. In doing my reading and research about robotic exoskeleton, I have discovered a lot of fun facts about this topic. So today, I would like to tell you all about the benefit of robotic exoskeleton. Before I start the presentation, I hope you all enjoy hearing about this topic as much as I have enjoyed preparing for this presentation. My presentation today will be divided into three sections, which are introduction, the benefit of robotic exoskeleton, and the conclusion as well. Let's get started talking about the benefit of robotic exoskeleton. Firstly, robotic exoskeleton ameliorate the progressive loss of bone mineral density. People with spinal cord injury usually use a power of manual wheelchair as their primary mode of locomotion indoor and outdoor. However, this often results in a sedentary lifestyle, which is associated with a 3 to 4% month decline in bone mineral density in the lower extremities in the first year after a spinal cord injury. And this will lead to an increased risk of fractures. Robotic exoskeleton will help in reduction mechanical force from both weight-bearing activity and muscle contraction that promote the remodeling of bone. So based on the Journal of Rehabilitation Medicine that was written by Carolis AD, we found that walking in an exoskeleton may increase bone mineral density up to 14% in the tibia with 6 weeks of training. There was one participant out of 5 who had an improvement in bone mineral density, which shifted his diagnosis from osteoporosis to osteopenia. Now I will pass to my partner Sichi, who will describe more on the benefit of robot exoskeleton.
Okay, so thank you, Jatin, for the first main point. And now I will introduce the second benefit of the robotic exoskeleton, which is to improve the quality of life. Maybe you will have a question here, how a robotic exoskeleton can improve the quality of life. So let me explain more details to you. First of all, a robotic exoskeleton can help people who suffer from paralyzing and spinal cord injury by allowing them to perform physical activity, especially standing and walking. In a BBC News on 4 October 2019, French researchers had reported that a man has been able to move all 4 of his paralyzed limbs with a mind-controlled exoskeleton suite. As we know, prolonged sitting time is an independent risk factor for cardiovascular disease, cancer, as well as a factor for increasing all-cause mortality. In this aspect, a robotic exoskeleton can reduce the risk of disease indirectly through encourage the physical activity to the patient. It can also reduce the sitting time and improve the parameters of physical activity. So as a result, a robotic exoskeleton can improve the patient's quality of life, not only allow them to do their physical activity such as walking and exercising, but also can reduce the risk of getting disease. In addition, a robotic exoskeleton can improve the quality of life by helping patients rebuild their self-confidence. This idea was expressed clearly in an article by ISEESE, which is International Symposium on Energy, Environmental Science and Engineering. Based on the article, the experiment result revealed that a robotic exoskeleton can improve the working ability of patients by simulating the real working environment and touch the ground feeling. Therefore, it can stimulate patients to strengthen their own motion control and make the exoskeleton a good rehabilitation tool. This training method can improve patients' self-confidence and stimulate their interest in rehabilitation training. Let me end by concluding the points that we talked about just now. In short, a robotic exoskeleton brings a lot of benefits, which include ameliorating the progressive loss of bone mineral density and improving the quality of life. Therefore, the robotic exoskeleton can be said that is one of the best rehabilitation services that can recover a person who suffer from SCI, paralysis, or even stroke efficiently and safely. That's bring me to the end of our presentation. Hope you all learned something new today. Thank you for listening.